Hey everybody, welcome on. My name is Dr. Kelly Peterson, also known as the Belly Whisperer. I've been getting a lot of really great questions about abdominal pelvic health, so I thought I would go live and let everybody know some information that I've been sharing. So if you're just joining me again, my name is Dr. Kelly Peterson, also known as the Belly Whisperer. I'm here today to share some information on pelvic health. I've actually been getting a lot of questions recently about do males also have pelvic floors just like females? And yes, so I kind of wanted to go a little bit about what is pelvic floor physical therapy and why is it important? Why do people need it? Some of us don't even see a pelvic floor physical therapist after we give birth, which is crazy to me because every female should have pelvic floor physical therapy before, during, and after childbirth, all right? If you sprained your ankle, you would go see a physical therapist. Having a child, going through labor, delivery, all of that trauma, it's just like an injury. You need to have that rehabbed. So basically, I want to kind of go over a little bit of the functions of the pelvic floor. Because of the censorship of TikTok, I'm not going to use my model right now because I don't want to get flagged or taken down for nudity. So kind of bear with me. Typically, when you're talking about the pelvic floor, it has 5 main functions, right? We always kind of talk about the 5 S's of the pelvic floor. One function is a sexual function, right? So I tell everybody, males and females have the same parts. They're just organized differently, right? So, females have, the clitoris. Males also have a clitoral gland. It's the head of the penis. So I always tell people, especially people that have the misconception of, finding the G spot. There is no G spot, right? It's just all a cluster. I call it a clitoral cluster. You can imagine that the clitoris is almost kind of like a wishbone. It almost looks like, kind of like the same shape of the penis. And then it has, basically you have the body, and then you have 2 legs called the crura that come off, and then you have the head, right? That big head, that's where you get the term the clitoris, right? It has a hood that's covered to protect it. That's why it's important to Kegel. Did you know that when you Kegel, you actually lift the hood open, right? So even if you pull in your transversus abdominis, which is basically trying to pull your belly button towards your spine, you may feel that same kind of Kegel or that same kind of contraction. You can feel the hood of the clitoris lift open. That's why it's important to have a strong pelvic floor and even a strong core, because you can expose the head of the clitoris to help with stimulation, arousal, orgasm. Okay, so like I said before, sexual function is extremely important for pelvic health. The next S is sphincteric or sphincter, right? So we have different sphincters of the pelvic floor. Basically, you have tissue, circular smooth tissue that can contract so we don't leak, right? We don't have fecal or urinary incontinence. If we didn't have those sphincters, we would leak all over the place. So that's another important function of our pelvic floor. Third is stability, right? Our pelvic floor is connected to our pelvis, our hips, our lumbar, or our low back. So if you're having SI or pelvis dysfunction, right? Low back pain, sciatica, hip dysfunction, all of these things can affect our pelvic floor, not just from, the musculoskeletal standpoint, but also the nerves. If you have a herniated disc bulging, disc degeneration, stenosis, spinal cord injury, all of these things can affect our pelvic floor as well. So having a strong pelvic floor, again, as well as being able to lengthen that pelvic floor, is important for stability of our pelvis, okay? And I always tell people core stability, our trunk, our abdomen is super important with our pelvic floor. They go together, okay? If you have a strong core but you have a weak pelvic floor, that's not going to be good for functioning like lifting weights, running, jumping, doing functional activities, right? Having that stability helps control our intra-abdominal pressure, so that way, we're able to do those activities without hurting ourselves. So next function, and another S, is called sump and pump, meaning our pelvic floor helps with vascular blood flow circulation as well as lymphatics, right? So just like any other part of your body, you can get swelling, pelvic congestion, varicose veins, right? Vulvar veins, those things are vulvar varicosities, those things can happen in our pelvic region. So it's super important that you work on lymphatic drainage. That's why exercise is important, movement. That's another function. Okay, so we've got sexual, we've got the sump and pump lymphatic, we've got the stability, we got the sphincteric, and then we also have the last S is support. So in females, our pelvic floor is like a hammock from one sit bone to the other, okay? It supports our bladder, our uterus, and our rectum. In males, you just have your pelvic floor supporting the bladder, the uterus, and you have your prostate. So they're very similar. Let's see, my lower back, I said a question really quick. My lower lumbar is fused together, not even possible. Oh, so lumbar fusion, yeah, that's something that a lot of people have, especially if they have instability, if they have some type of low back pain causing such a foot drop or sciatica-like symptoms, radiculopathy. If you have a lumbar fusion and you're having pelvic floor issues, numbness tingling down your leg, numbness tingling in your groin, highly recommend seeing a pelvic floor physical therapist, especially one that specializes in pelvic floor. Make sure you don't have any bowel or bladder issues after a fusion, because some people, unfortunately, during low back surgery can have their nerves affected, all right? Even though the surgeon may not necessarily cut into the nerves of the pelvic floor or the sacral nerves, you can still have swelling and inflammation causing you to have issues with urination, fecal incontinence, those types of things, okay? So if you're just tuning in, my name is Dr. Kelly Peterson, also known as the Belly Whisperer. I'm a doctor of physical therapy, but I specialize in abdominal pelvic dysfunction, okay? What I love to do is I love helping people with constipation, bloating, pelvic pain, difficulty with penetration, putting in a tampon, intercourse, arousal, orgasm, all of those things, right? Like I just talked about, all of those things all of those functions of the pelvic floor, those 5 S's, those are all the things that a pelvic floor therapist can help with. Another question, bladder prolapse doctor wants to do 3rd surgery, but feeling better after seeing a pelvic floor therapist. That is awesome. Okay, you are amazing. Thank you for sharing that. If you have pelvic organ prolapse, for instance, bladder prolapse, also called a cystocele, please see a pelvic floor physical therapist before you get surgery. Unfortunately, I don't know why they want to do a 3rd surgery. We would need more details. But what can typically happen is they'll go in vaginally or laparoscopically, and they'll put in a mesh, kind of a material to help keep that bladder from falling down, right? There's different levels of prolapse. A lot of people are walking around with grade 1, grade 2 prolapse, meaning wherever their bladder was originally in the normal position, it's kind of lowered and now it's trying to come out. For instance, in females, the vaginal opening or the rectal opening for males. So it is really, really tempting to get a surgery because you think that this is going to fix your incontinence, this is going to fix your pelvic pain, that heaviness, that pressure feeling in your vagina and your vulva. But I'm telling you, you really want to avoid this surgery unless you really need to. Unless you have, a grade 4 where it's completely falling out. You have so many issues, like you can't even urinate, you're having urinary retention. Avoiding surgery is always the best thing to do. It's really unfortunate when we get people in our clinic that jump really quickly to get a hysterectomy, to get cysts removed that are benign, that don't even cause them any pain. And then what happens is they get these types of surgeries and then they have all these other types of issues sometimes, difficulty, they have swelling, they have pain. So really, really highly recommend seeing a pelvic floor therapist, okay? Thank you everybody for joining in. If you're just coming in, my name is Dr. Kelly Peterson. I'm a physical therapist. I specialize in the abdominal pelvic dysfunction. I'm talking about pelvic health. Males and females both can have pelvic floor dysfunction. I personally feel that women need more pelvic floor therapy, especially women that decide to have children, right? Going through pregnancy, labor and delivery, is a big deal. And it's a lot of wear and tear on your body. And if you don't know how to recover that properly and you try to just jump back into work, into doing your daily activities, that's when people can get prolapse. That's when people get the diastasis recti or the abdominal separation. A lot of people go to their 6-week checkup and their doctor tells them that they're all great to go back to sex, to go back to working out and running. And these people don't realize that they have gone through a major thing, right? You just had a baby come out of there, right? Just imagine like a little baby bowling ball, or maybe a watermelon. I love watermelon coming out of there, right? All of your ligaments, all of your tissues have stretched and expanded to help, allow that baby to pass. And then imagine if you have a C-section, right? Now you have somebody cutting through multiple layers of tissue. People think that they just kind of go through the skin. You're going through muscle, right? You're going through fascia, connective tissue. You're cutting through so many layers. It's a big recovery. So I highly recommend, I always tell people, see a pelvic floor physical therapist, okay? Talk with your doctor. Even if your doctor doesn't recommend it, advocate for yourself. You have autonomy. You have the right to what happens to your body with any healthcare professional. So please see a pelvic floor physical therapist. Somebody else commented, thanks to you, I'm using the pelvic wand. It really helps. Oh, the pelvic wand. You guys, I tried to do an Instagram live like 2 weeks ago and I was banned for like a week because I brought on a pelvic wand. And I brought on dilators. Oh, wait, is that upside down? Sorry, that's upside down. I brought on dilators and wands and I wanted to tell everybody how awesome these are for your pelvic floor. But I can't open these up because I'm afraid that TikTok will take me down, but I will talk about this. So she brought up the pelvic wand. These are great. I like Intimate Rose. They're medical grade silicone. They're super comfortable. They're my favorite brand, but it doesn't matter what brand of pelvic wand you really use. Pelvic wands are a great tool for doing trigger point release or releasing muscle spasms of your pelvic floor. I like to think of it like this, okay? How many of us have tight necks, right? How many of us do this all day at work? Everything is tight. Everything is sore. You may get radiating pain into your jaw. You may even be getting headaches, those type of things. So what do? You push on it. You release it. I even do cupping to this area. You release that trigger point. Well, your pelvic floor is the exact same thing as your upper trap. It's still a muscle. It's made of the same tissues. You need to be able to release those if you're somebody that suffers from, pelvic floor tightness or pelvic floor hypertonicity. Because if not, then you can get similar things that you get here. Radiating arm pain, migraine, headaches, neck pain, stiffness. Same thing with your pelvic floor. Using a wand like this is a great way to help release those trigger points by yourself. Now, the difference between releasing a trigger point externally, it's a lot more difficult because you can't see, right? I mean, I know there's only 9 of you out there, but how many of you guys have actually taken a mirror and looked at your pelvic floor in the last week? How many people go down there? How many people take their finger and they feel around in there and check and see what they feel? Maybe not that much, right? Our partners may do it. They may enjoy that. But a lot of women, especially women, they do not know what's going on with their pelvic floor. They don't really even know where their clitoris is. And, you shouldn't be ashamed of that. It's just, the reason is because a lot of us don't get that education. So learning to use wands, learning to explore down there with a medical professional. I always recommend when you're using a wand, you need to have the guidance and the help of a physical therapist, a pelvic floor physical therapist, because it can be so difficult to navigate that. But once you learn your trigger points, it is life-changing. I'm telling you, because this is what I tell a lot of people. If you're somebody that is younger, typically you may have a more hyperactive or tight pelvic floor than someone that's older, because as we age, and especially if you have childbirth, right, tissues can lengthen, get weak, and get a little bit more loose or lax. So for young women, they usually have a tight pelvic floor, and this can actually be a big problem. Some people have a hard time reaching orgasm or climaxing because their muscle is already fully contracted. I talk about this all the time. What is an orgasm? Rhythmic contractions of your pelvic floor. So if you're already fully contracted like this, it's going to be difficult to reach orgasm because the muscle is fully contracted. You need it to be able to lengthen and contract. It's gonna enhance your orgasm. And with the use of, pelvic wands, this is a great way to help with that. Another thing I talk about all the time, right? Kind of one of the reasons where I got my name, the Belly Whisperer, the belly, diaphragmatic breathing. So diaphragmatic breathing is the foundation of a healthy body, and particularly a healthy pelvic floor. If you're somebody that suffers from bloating, constipation, abdominal pain, pelvic pain, you really need to see somebody that can teach you how to do diaphragmatic breathing. It's life-changing, okay? Especially if you're in this day and age with all the social media, stress, anxiety, all of those things can exacerbate your symptoms. And if you're somebody like me, I have IBS. I've gone through all of these things, ulcerative colitis, internal hemorrhoids, all of these things that were undiagnosed for a long time. And I finally found the right doctor who was like, oh, you have this many things. And once I figured out how to treat it and manage my symptoms, it was life-changing. I mean, it's basically once you learn what triggers your symptoms, or once you know the source of your pain and how to treat that, it allows you to be able to be anywhere and not have issues. Because for some of us, we're afraid to go out and socialize with people. We're afraid to travel. We're afraid to be places, eat different foods. And because why? Because we don't know when we're going to have a flare-up. Because you don't know if you're going to eat something, and then the next thing you know, you can't poop for 5 days. You have horrible diarrhea. And it can be really embarrassing, especially if you're dating somebody new. So, and that's why, like a lot of us, that's why people get disordered eating. So I don't want to go down that rabbit hole. We're not going to talk about me, but it's super important. I've got a couple great questions. I'm older, 3 kids later, mine is overly tight, and I didn't realize how much pain I was actually in. Yes, like I said before, not everybody when they get older gets weak. You can even have a mixture. A lot of people have a mixture of tightness and weakness. And what can be crazy is, if you can imagine the pelvis, right, is 2 sides. You may have tightness in 2 muscles on the right, but then you have weakness on this one muscle on the left down here. So your obturator internus muscle may be tight over here, but your coccygeus muscle may be loose over here, and you may have a mixture of things. I know it seems kind of scary and I'm using big words, but really once you see a pelvic floor physical therapist, it literally opens up like a whole new world of why you're having the pain that you might be having and how to treat it. And I tell people this all the time. Your sciatica, your hip pain, your radiating pain can be coming from your pelvic floor because of nerve innervation. So I highly recommend seeing a therapist. How do you know if you're too tight or you're too loose? Great question. If you really want to know, you need to have an internal assessment. If you're comfortable with that, you can do one on yourself. I actually offer a free video on my website using a watermelon, and basically you use your finger and you'll go all the way down to the knuckle here, right? If you're pretending this is the first knuckle, second, third, or the DIP, the PIP, and the MTP here, you go here so you can insert this all the way in to the opening, and what you'll do is you'll Kegel or contract. How do you know if you're too tight? And you can use grading systems that pelvic floor physical therapists use. I talk about this in my video to kind of grade from a 0 to 5 scale. But to kind of get a general idea, if you want to feel, can you feel the both the top and the bottom walls grip around your finger? That's a good sign. Second thing, can you feel that grip and then that pull upwards? So you can imagine that pull will be up toward your head. If you can feel a squeeze and a lift, that means you have a decent Kegel. I'm just generalizing. You may have a good contraction. That is healthy. How do you know if you're too tight? you may go in to do that and you can't feel anything. Maybe you feel like a flicker. Maybe you feel kind of a squeeze, but not really. What that may mean is you may be, and that may be happening because you're already so tight, your Kegel or your quality of contraction is not very good. It comes off kind of flickery or weak. Now, on the other side of that, you may only have a small grip or a flicker or a fasciculation, as we say, of the muscle because you're very, very weak. So what would have to happen next is you would have to palpate or push around inside on different muscles. A pelvic floor therapist would do this for you. And then if they feel that stiffness or it causes pain, it reproduces your symptoms, that's a really good indication of, ooh, yeah, you have tightness on this side. So it's hard to know when you aren't trained in it if you have a tight pelvic floor, but there are very common symptoms that a lot of people have. Recently, I've been posting a lot of videos on Proctalgia, right? This is like the sharp, sudden spasm pain in your lower rectum or your anus. That's something that's very common in people that have tight pelvic floors. Not always, but there are different signs that can indicate that. Constipation, difficulty having a bowel movement, feeling like your poop is getting stuck. Those may be indicators of a tight pelvic floor, but like I said before, if you really want to know if your pelvic floor is too tight or too loose, you do need to have a pelvic floor assessment. But like I said, I have a free video on my website. You just have to click the link in the bio and it will take you to my main website. Click Learn More, and that takes you to my Teachable website where I have tons of self-care videos. I have free videos on TMJ and pelvic floor strength. I have free videos on perineal massage, and then I also have videos that you can purchase on using dilators, wands. My favorite new video is pooping techniques. I am actually sitting on a toilet with my pelvic model talking about how you should be pooping, how you should be breathing, different techniques, especially if you suffer from constipation, internal hemorrhoids, if you've just had a C-section or you're postpartum, you may have a diastasis. These self-care videos are great. They're short videos. I am right now working on making a giant method that I'm going to launch. I'm hoping in the next few months. I'm trying to hire some professional videographers, all of that. So just be patient. My method that I treat when you come to me in the clinic, the method that I use, my 5 B's of the belly whisper method, I want to take that and put it online for everybody. So people that aren't near me, that aren't in Orange County can access that. So be patient. I promise you it's going to be, if you're someone like me that has suffered from irritable bowel syndrome, ulcerative colitis, internal hemorrhoids, misdiagnosed with Crohn's disease and then celiac disease, and have had so many doctors tell you there's nothing wrong with you and then actually there is, this method is for you. Okay, so I'm not going to harp on it. You can go on my Instagram. I have so many videos, more information on my method. Next question, I have a mixture. Okay, is there any at-home machine you would recommend to measure? No, I would not recommend using an at-home machine to measure your pelvic floor. What you could do, I didn't bring the Kegel weights, but you know how Intimate Rose also has the vaginal weights? What you can do to test your pelvic floor, a quick test is lie on your back, take the vaginal weight, make sure you might need to put a little lubricant on there, make sure it's clean. You can insert that vaginal weight like you would a tampon, stand up, maybe do a squat, walk around. If that vaginal weight falls out immediately, that's an indicator that you might have pelvic floor weakness. A healthy pelvic floor can put a vaginal weight in and you can keep it in. And then you have people that are really tight that are just like, I can leave it in for an hour. I leave it in while I cook. Now, you don't want to do that necessarily, but those are quick ways to measure, do you have pelvic floor tightness, loose or weakness? But like I mentioned before, pelvic floor, Kegel contractions, it's not just about strength and length, it's about quality of contraction, meaning can you fully contract but also fully let it lengthen? Can you do that repetitively? Can you do that maybe 4, 5, 6 times? Can you activate those slow twitch muscle fibers and those fast twitch? Right? I always talk about this. Our pelvic floor muscles are made up of 70% slow twitch muscle fibers and 30% fast twitch, because we need to be able to Kegel quickly if we cough, or sneeze. If we didn't have that quick contraction, every time you laughed, every time you yelled or you sneezed or you coughed, you might pee your pants a little bit. You may even have fecal incontinence. You would leak. So leaking is never normal. Everybody likes to joke about, I was thinking about getting my mom this Mother's Day gift that says something about, thanks for sacrificing, thanks for peeing your pants every time you laugh, for having me as like a joke, a mug. But really, it's not funny. And it's not normal. I mean, it's funny, but it's not normal. If you are leaking when you're laughing, when you're sneezing, when you're coughing, it's not normal, and you want to get that looked at. And here's why. So I'm going to take a sip of water. I had so many patients today in the clinic. It was a really crazy day, so my voice is a little hoarse from talking to people. If you are somebody that is leaking, you want to get that checked out, and here's why. I don't want to go on this crazy rant about why our elderly population does not get enough help for urinary tract infections, but one of the reasons why so many elderly people get hospitalized, get sick, they pass away from urinary tract infections is because they have weak pelvic floor muscles and they're leaking and they are pooping and they are constantly getting that area as moist or wet, which causes bacteria to grow, and that's why they get UTIs. And the sad thing is people, when they get older, they don't necessarily have that traditional pain with urination. They may have no pain. One of the most common things you'll see if you are elderly and you are having a urinary tract infection is confusion. Your significant other, your mom, your grandmother will be acting very weird. They will be confused. They'll be very cloudy, tired. You want to get that checked out. If they're having recurrent urinary tract infections, this is what leads to multiple hospitalizations, and then they go in the hospital and they get pneumonia. So I love working with the elderly so much. Most people don't know this, but I did home health for a while. I went to people's homes and I worked with a lot of very sick people, young people that were, had really, sad and really difficult autoimmune diseases, MS, lupus. So, and then also with elderly. So I have a really big passion for elderly population. They are underappreciated. They are mistreated when they go to their doctors. You need to go with them. If your grandmother, your mother is having multiple urinary tract infections, make sure that doctor is running a urine analysis and they are not just giving them the same damn antibiotic that does not take away their UTI. They need to give them an antibiotic that is for that strain of urinary tract infection. A lot of people have recurrent UTIs because the doctor just gives them the same antibiotic that worked last time. Well, if you're getting urinary tract infections constantly, every few months, every 6 months, multiple times a year, that is abnormal, and you need to see a urologist, you need a different gynecologist, you need to figure out what's causing all of those urinary tract infections. Some women's urethra is actually closer to the opening or closer to the rectum and is more exposed to bacteria, to fecal matter or poop. So they are people that get, more recurrent urinary tract infections, especially with sex. But some women actually have interstitial cystitis. So basically chronic inflammation of the bladder, and they're getting misdiagnosed with multiple UTIs. So this is another thing I want to harp on about. You know your body better than any doctor, okay? I'm going to say that again. You know your body better than any doctor. So if you're telling your doctor that something is abnormal, doesn't feel right, and they're not listening to you, get a new doctor, because it's unacceptable. I remember when I was younger and having these issues, and my doctor just kind of sloughed it off like, oh, it's normal. But now that I have my degree in biology, I have my doctorate in physical therapy, I have like my specialties now. I wish I would have known what I know now, but you know what? It's okay, because I'm going to literally educate people until everybody gets the help that they need, okay? Sorry, I went off on a rant there, but what I'm saying is multiple urinary tract infections are very unhealthy, they're abnormal, and you need to make sure you don't have something else going on. Make sure your doctor runs a urine analysis, make sure that you're getting the right treatment, okay? I had some great questions. I'm going to go back. Let's see. Thanks everybody for joining. My name is Dr. Kelly Peterson. I'm a physical therapist and I specialize in abdominal pelvic health. I love touching bellies. I love working on the bellies. I do visceral manipulation, meaning I do manipulation of the organs, the fascia, working on restrictions, especially if you're somebody that's had surgeries. I mentioned before, if you were just joining in, that I have had IBS, ulcerative colitis, gut issues. I actually had my gallbladder out when I was 19. So I've had a lot of these crazy issues, and I know I've worked on my scar tissue through some of the techniques that I do, and I want everybody to do that because it helps so much. You don't realize when you have, your appendix removed, you have an organ removed, you may have postural deficits, you may hug into your lesion, it may cause you to have different postures, and that can affect your daily life, your sleep, your sex life, everything. So my mission is to help other people with that type of issues. Okay, my wife has gone for prolapse correction surgery but lost pelvic floor control. Very stiff. Any advice? Okay, so like I said before, getting that mesh surgery, typically, like I said, you can get it transvaginally where they go in, you can get a laparoscopic, depends on the surgeon. You need to see a pelvic floor. She needs to see a pelvic floor physical therapist to figure out why she doesn't have pelvic floor muscle control. Did she have any nerve damage during the procedure? Is she just weak from maybe swelling or pain? There could be lots of things. And if it's fresh after surgery within the first, couple of weeks, 4 to 6 weeks, don't panic. These type of surgeries can take months to heal, all right? Even up to a year. So you need to see a pelvic floor physical therapist to figure out what's causing that muscle loss of control. Okay, muscle relaxation advice, diaphragmatic breathing, like I mentioned before. You can use a pelvic wand, but she's going to want to use this under the guidance of a pelvic floor PT, especially if she has a mesh in there. Some women can have scar tissue, and when you go in, for instance, I will go in with my finger, I can feel some of that scar tissue. I can feel the mesh. You want to be very careful you don't perforate or puncture that tissue. And some people may even get a little bit of bleeding after. So you want to see a pelvic floor physical. Oh, there aren't any in South Africa. She's 3 months into recovery. Oh, man, that's tough. That really hurts my heart. Okay, I'm going to need more detail on this, but I offer online consultations if you want. My cheapest one is $25. I don't know if I know I treat people, my credit card works for people in, I've treated people in Canada, Kuwait. I think it works in England, Japan. I don't know if it works in South Africa. But what I can do, they fixed her prolapse through 3 incisions in her belly. Okay, so they did the laparoscopic. Okay, she may have scar tissue restrictions over those incision sites. Doing scar tissue mobilization or trying to mobilize those scars can help maybe if she has stiffness. I would recommend doing that. You do want to be careful. If she's really sensitive over the incision sites, you can work above it. So, that's tough. She's going to need more one-on-one care for that because it's hard to know what's causing her. She may have tightness because of just what they did for the surgery. What you can do too is if you're talking about having tightness and she's unable to have penetration or intercourse, you can look at dilators. There are different ones, right? The smallest size is really tiny. It's even smaller than my pinky and it goes all the way up. You can look into something like this where she can kind of manually put something in there, and that may be what she needs to stretch it out. If you're talking about having, it's for intercourse. Yeah, you should look into dilators. Go on my website. I think you should be, if you click in the bio link in there, I have a self-care video on how to use dilators. Or she can book an appointment, but using dilators can help with stretching out pelvic floor if you're somebody that has pain with penetration or vaginismus, okay? But, oh gosh, give it time. Making sure you're working on breathing, right? Inhalation, exhalation. When you're using the dilators or whenever you're inserting during sex, you always want to inhale. That helps with lengthening your pelvic floor for relaxation. And then when you exhale, that's when your pelvic floor will contract or it will go up. So there's so many different things you can do. I got another question. Okay. Oh, same one. Okay. Thanks, everybody. If you're joining in, my name is Dr. Kelly Peterson. I'm a doctor of physical therapy. I was just giving some advice on pelvic organ prolapse after surgery. A lot of people can get difficulty, pain with penetration after the mesh may be really tight. So I was recommending, dilators like these. And if these ones are too expensive, Intimate Rose makes great products. There are different dilators. There are cheaper ones. So I just want to put that out there. I also offer pelvic floor stretching on my website. So look into different stuff. Okay, what time is it? I gotta go eat dinner soon. You guys are awesome. She has IBS and constant bloating too, plus the prolapse. Yeah. It's really unfortunate, that there aren't more pelvic floor physical therapists abroad, especially South Africa. It's a specialty that I think is going to be up and coming in the years to come, and there are going to be more resources for people. But yeah, I'm sure a lot of times people that have pelvic floor issues, they don't always just have one. They have other things that go along with it, constipation, bloating. So hang in there. I'm going to be putting out my method in the next few months. So, but yeah, really good luck with that. That's a tough procedure. Going through a prolapse surgery without having a pelvic floor physical therapist is a very hard thing to do. So if you're just tuning in, I'm kind of wrapping things up. I'll link in my bio, and then you can go to schedule an appointment. If you have any problems, I see your name. I'll reach out to you. But if you go link into my bio, it will take you to my website, and then you just go to the homepage and hit schedule an appointment. Okay, I do. If you're just joining, I do online appointments. I work in Orange County, California. I do in-person visits as well. But for people that don't have access to pelvic floor or visceral physical therapy, I do offer online consultations. You're welcome. I really hope that, you guys reach out. I really want to help her more, but I need to do one-on-one, and I want to ask more personal questions. But yes, I love answering all of your guys' questions. You guys have had some really good ones recently. If you have really personal, specific questions on difficulty with orgasm, arousal, painful penetration, difficulty putting in a tampon, if you're somebody that has excessive gas, excessive bloating, smelly, farts, all of those things, it can be so many things. And if you want me to answer those personal questions, I would love to help you. Please look into an online appointment. I know with COVID and the pandemic going on right now, money can be hard, but I work full time in the clinic helping patients, and I have my own online business. I'm really busy, and it's hard to answer everyone's questions. If in a perfect world, I would love to help everybody, but I have to, I can only do so much, but keep waiting. My method is coming out soon. I'm really excited. It's going to be a bunch of courses, a bunch of videos, a ton of information, PDFs. It's going to be everything that I do to treat people with abdominal pelvic health. It's really, honestly, I created this method going through all of the problems that I had, having my gallbladder removed, having irritable bowel syndrome, having ulcerative colitis, internal hemorrhoids. And you know what? I know what I talk about is weird and people think it's taboo and it makes people sometimes feel uncomfortable. Well, you know what? I don't care, because a lot of people have the same problems. And if we don't talk about this, if we don't normalize it, people are just going to be walking around and suffering. So many people have endometriosis that gets misdiagnosed, undiagnosed. People have painful periods. They don't know how to manage those symptoms. So if you are somebody that's suffering, if you are somebody that has any type of pain, please see a physical therapist. One of the cool things about physical therapy is it's non-invasive. It's something that literally everybody should have, because it helps with posture, with strength, with stretching, right? It helps with all these daily activities. And I'm telling you, if you do pelvic floor physical therapy, your sex life will improve. And communicating with your partner about things for your sex life is going to make it so much better. Even if you have a great relationship with your partner, even if you're somebody that, can orgasm and all of that, it's still something that can enhance your intimacy and really help down the road, especially if you do develop pelvic floor dysfunction after you're having kids, those type of things. Thank you for your kindness. I love, you guys are awesome. Thank you for all the shout outs. I really appreciate it. And like I said, hopefully more people will buy into pelvic floor physical therapy. More people will understand visceral physical therapy, and I can put more videos out there. Right now, TikTok censors me so much that I can't even share some of the videos I want to, because they instantly call it nudity and they remove it and take it down. So I'm sorry if I haven't answered some of your questions, but sometimes TikTok won't even let me answer if I use certain words or if I show certain tools. So I'm thinking about busting out my watermelon again, maybe trying some pineapple, maybe some cucumbers, and I'm going to give you guys some awesome information and hopefully help your tummies, okay? Thanks for joining me tonight. I'm going to go eat dinner with my husband. If you want more information, follow me on my Instagram. I have a YouTube channel. Everything helps, so I really appreciate it. Thanks, everybody. One last message. Okay. Awesome. No messages, just kidding. All right. Take care, everybody. Thanks for joining me. I hope you guys learned a lot about the pelvic floor, and let everybody know that males can have pelvic floor dysfunction too. I just had a patient in today that said his PSA levels were high. You know, right? Prostate cancer happens in 50% of men over the age of 65. That's 1 in 2 men. So if you think that your pelvic floor is safe for the rest of your life, I guarantee you're going to have some type of issue down the road. All of us have had diarrhea. All of us have had constipation. All of us have had issues going on, so it's really important to educate people that, yes, it is okay to have those type of things going on, but there are pelvic floor physical therapists that treat males and females, all genders, everything. So if you are having any type of pelvic dysfunction, please see a pelvic floor physical therapist. All right, everybody, have a good night. Thank you.